When working on the soft tissues of the cervical spine, particularly muscles that cross multiple joints like the upper trapezius and the levator scapulae, I find a kind of pin and stretch approach to stretching these myofascial structures very useful. Obviously, we're not really changing much from the physiological perspective when we try to stretch a muscle like this. But we're giving a lot of feedback to spinal cord, brain, both from our hand contact on the patient's skin, but also the sense of passive stretch that the patient feels in the muscle. And this can help feed into our approach that is reassuring the patient, helping them feel confident in the movement of those areas, and reduce the sense of tension and protective muscle spasm. But as with all the different techniques, it's very important the context in which it's delivered. So I refer to this point again and again. It's about how you convey the efficacy of the technique to the patient. So we're not magically lengthening any muscle or changing anything in the biomechanics or the structure of the muscle, but we are giving a lot of feedback, reassurance through our touch, reassurance through stretching and moving these tissues. So it's important to bear that in mind as you do these techniques. Going along in that same vein, it's important not to aggravate, cause pain, cause a lot of excess discomfort. We need to work within a comfortable and relaxing range for the patient. That's a key principle in my approach to osteopathic treatment with these kind of soft tissue structures. So starting with the upper trapezius, it's good to have a contact on both the origin and at least the attachments of both ends of the trapezius. Obviously it's attaching here onto the nuchal line on the external surface of the occipital bone and to various structures in the shoulder along the acromion, the lateral third of the clavicle, and the spine of the scapula partly as well. So when blocking or stretching the movement, we can use a broad hand contact over that attachment on the bone, or we can use specific contacts within the body of the muscle if we want to block or stretch or give feedback to the patient from specific portions of the muscle. So in general, when doing this technique, I keep my hand contact on the head relatively fixed. It's controlling the head movement and giving a little bit of soft tissue feedback here, while the left hand is moving, constantly changing position and getting feedback from the patient as I work on different structures. So just to demonstrate what that technique looks like, of course you can do this standing or seated. Generally I take a seated approach. Just me being more comfortable as a practitioner allows me to spend more time moving the patient around. Sometimes I'll briefly stand up to properly stretch an area, but generally I stay seated for these techniques. But again, it is important to get close to the patient and control the movement. My right hand here is hooking, or kind of supporting the whole occiput. It also allows me to give a little bit of traction and keep the cervical spine slightly flexed rather than dropping the C-spine into extension. My left hand is going to, as I said, block the bony attachments or parts of the muscle specifically. Here, I'll depress the shoulder first and then just gently stretch the muscle here. So I'm getting quite a broad stretch through the trapezius at this point. Then you can see that through the tension that I'm applying on the skin. I can change my contact to a thumb contact to work on specific fibers within the muscle. And I want you to really note how my thumb and my fingers here are working together to individually stretch parts of the muscle. Now obviously I'm focusing on the upper trapezius, but I could be catching fibers of Levator Scapulae, Splenius, Capitis, even parts of the scalenes in here as well. It's very difficult to be super accurate with these techniques. We don't know exactly what we're palpating half the time, but we need to make the best effort possible. It's more accurate, it's more comfortable for the patient. It makes your hands more confident as you move around. So I always take the best guess approach. Make your best guess. If it's slightly off, it at least will be better than doing a very general, broad technique without that thought for the specific structures that are underneath your hands. It just gives a more caring approach, essentially, in my opinion. So, just to go over that again, I can depress the shoulder and do a general stretch, or I can take much more local hand contact on different parts of the muscle here. I can rhythmically move the muscle under tension and back to neutral, or I can sustain a stretch in a specific position. I can utilize the patient's breathing in this position to help them relax, particularly if there's a little bit of pain as I stretch the muscle. I can transition to different parts of the upper trapezius, or even use my fingers here to stretch in this manner as well. It's important that you're comfortable in terms of your posture as a practitioner, and I keep quite a wide and broad base with my feet underneath the plinth so that I can balance and move through the full range of motion here. Sometimes, in order to stretch the upper trapezius properly, I might flex the C-spine. So as I mentioned, just standing and flexing here and stretching that muscle in this direction. And I might sustain that stretch for a few seconds and then change position. I might use an alternative movement like rotation to stretch it in a different direction. This kind of technique can work quite well in combination with basic neuromuscular techniques like essentially massage techniques, longitudinal and cross-fiber neuromuscular techniques using some kind of lubricant on the skin.